Hello everyone, welcome to sqadia.com, and now we will talk about the abnormal menopause. In the abnormal menopause, we will talk about premature and delayed menopause, artificial menopause, and menopause caused after surgery or radiation therapy. So abnormal menopause, it can be premature, delayed, artificial, surgical, and radiation menopause. So abnormal menopause is basically divided into 5 different types. In premature menopause, it occurs prematurely and before the time for the menopause, which is usually after in most cases, after 50 years of the age. So it occurs prematurely. And with the premature menopause here, if you see in this diagram, there is changes in the lining of the uterus. Endometrium is changed. There are changes in the lining of the vagina also. Delayed menopause, usually when the menopause occur after the time when it should be present, that's delayed menopause. And usually delayed menopause is seen in cases when there is good health habits or good diet habits. Usually that can lead to delayed menopause. And it is also seen in patients who have uterine fibroids. Patients with uterine fibroids, usually they have delayed menopause. Fibroids leads to abnormal heavy bleedings. So females who have fibroids, they can have delayed menopause. With high risk of endometrial cancer, usually there is delayed menopause also. So 3 main reasons for delayed menopause: when it is after the time, it is due to eating habits, health, and better nutrition leads to delayed menopause, and then also due to presence of fibroids. Fibroids are the growth of the smooth muscles cells, and they invade the lining of the uterus. So with the invading of the lining of the uterus, there is bleeding. So it leads to uterine bleeding continuously. So fibroid is another cause, and then women with high risk of endometrial cancer. Artificial menopause is usually done by the artificial means, and these artificial means are usually the surgery in which the ovaries are removed, and then the radiation therapy that can damage the ovaries. Surgical menopause, there are different types of surgeries done. In total hysterectomy is complete removal of the uterus and the cervix. This marking here, margin, this is total hysterectomy. Complete removal of the uterus and the cervix, total hysterectomy. In radical hysterectomy, uterus and the fallopian tubes and the ovaries are removed. This is radical hysterectomy. So nearby tissues is also removed in radical hysterectomy. Complete uterus, fallopian tube, ovaries, so everything is removed. In total hysterectomy with salpingo-oophorectomy. Salpingo is for fallopian tube, oophorectomy, oophoro is for ovaries, ectomy is removal. So total hysterectomy means uterus is removed completely, but there is, on one side, there is removal of fallopian tube and ovary. So this is unilateral salpingo-oophorectomy. In this second type, if you see, there is hysterectomy, total hysterectomy, and bilateral. Both sides, fallopian tubes and ovaries are removed. So this is bilateral salpingo-oophorectomy. So these are the 3-4 methods. Total hysterectomy only, radical hysterectomy, in which all the ovaries, fallopian tubes, uterus, and some nearby tissue is also removed. Then in this, with unilateral salpingo-oophorectomy and bilateral, these are the two incisions used for the surgery: low transverse, very low bottom, transverse incision, and vertical incision below the belly button and goes down. So this is the vertical incision. Radiation menopause, this is by the radiation. It is common in women below the age 40 years. And in this, the castration is not permanent. So after the radiation is stopped, usually after 2 years, there is resumption of conception is possible. So with this radiation menopause, this is not the permanent menopause. So in this, the endometrium is destroyed by the radium or radiation. So once the radiation therapy is stopped, within 2 years, usually there is regeneration and recovery, and conception is possible. So that was all about the abnormal menopause, in which we talked about artificial, premature, delayed menopause, and also menopause after surgery and radiation therapy. Thank you for watching sqadia.com.